Oh, there he is.
Okay, there he is.
Just weird.
It is Thursday, March 7th, and the Finance Committee is in a voting session, and we are going to start with Nathan on Senate Bill 216.
So as amended, Senate Bill 216, which is shown in a reprint before you, is a departmental bill that increases from 10,000 to 25,000 the maximum penalty that an employer must pay to the uninsured employers fund for certain violations. So the amendment authorizes the Workers' Comp Commission to assess a penalty of up to $25,000 rather than mandating the penalty at $25,000 as introduced.
Can I have a motion?
Favorable.
Thank you. Second. So I'm gonna call them out. I always call them out. Senator Klassmeyer motion and Senator Hayes seconded. Right, that's right. Okay, all in favor of Senate Bill 216, let's raise our hands and hopefully it's unanimous. It's a unanimous vote, 11-0. Nathan?
Next bill is Senate Bill 234, which is a departmental bill that authorizes the Secretary of Labor to exempt a federal civilian employee who has been furloughed from the requirement to be actively seeking work for unemployment insurance benefits eligibility if during the furlough, the employee remains able to work, available for work, and work attached. There are no amendments. There's no fiscal impact. There was no opposition at the hearing.
Motion, please.
Move favorable.
Senator Guile moved favorable. Senator Klassmeyer seconded. Okay, are we all in favor? Can I see you're not in favor? Okay, we did need to do a roll call. Tammy?
Senate Bill 234 favorable. Vice Chair Klausmeyer.
Yes.
Yes. Senator Kramer.
Yes.
Yes. Senator Hayes.
Yes.
Yes. Senator Reedy.
No.
No. Senator Ellis.
Yes.
Yes. Senator Mounts.
No.
No. Senator Washington.
Yes.
Yes. Senator Guile.
Yes.
Yes. Senator Lamb.
Yes.
Yes. Senator Hershey.
No.
No. Madam Chair.
Yes.
Yes.
I'd like to have a conversation.
Okay. I
The
just looked at the, okay.
The next bill is Senate Bill 476, which is an administration bill that establishes additional occupational disease presumptions for specified public safety employees, generally speaking firefighters, who contract thyroid, colon, or ovarian cancer that is caused by contact with a toxic substance encountered in the line of duty. There are no amendments.
Move favorable.
I'm sure.
Wait a minute. Senator Klassmeyer motion, Senator Hayes seconded, and Senator Hershey has a question.
Senator Hershey would like to add a amendment, to add Senator Hershey and Senator Reedy to the bill, please, as sponsors.
Okay.
We can do
After-
that amendment,
after you-
Senator Hershey and Senator Reedy,
Correct. Mounts is already on it.
and Senator Ellis and Senator Mounts. Okay, does everybody want to be a co-sponsor on this good workman's comp bill? Is this everybody? A Powell amendment, everyone, okay? I know I'm already on it,
Do I still have to see you later?
yes. Okay, I'm assuming that's a favorable vote. Everybody wants to be a co-sponsor. All right, Senate Bill 476, 11-0.
Next bill is Senate Bill 846, which requires the Department of Labor to conduct a study on the actively seeking work. Oh, thank you. My files are out of order. So as amended and shown in the reprint before you, Senate Bill 830 establishes a licensure exception to allow individuals to perform limited x-rays of the chest, extremities, and spine under the supervision of a physician or radiologic technologist in a physician's office. Individuals authorized to perform x-rays under the bill as amended must register with the Board of Physicians, comply with specified education, experience, training, examination, and continuing education requirements. The bill includes civil penalty provisions that authorizes the board to adopt regulations implementing the bill's requirements. The bill is effective January 1 of 2025 and sunsets after 5 years. So the amendments offered by the sponsor strike the bill as introduced, which would have established a separate license classification and substitutes the bill I've described.
Motion,
Move favorable.
Senator Glassmeyer, do I have a second? And Senator Reedy. Do we have any questions? Senator Lamb?
Next bill is Senate Bill. Oh, I'm, sorry.
I was just like,
I didn't even hear it.
all right. Yeah, I know, seriously. My buddy over here. A quick technical question for council. Can you just specify what the hours are for didactics and also hands-on training? Just to clarify.
So in item A, which you can find on hand mark page 3, there is a 6-month of clinical care experience requirement. And then the additional requirements related to training are covered in B and C, which is that the individual complete a limited scope X-ray education program consisting of at least 115 hours of didactic training. And then also complete at least 480 hours of clinical training and successfully complete a minimum of 5 competencies in each body part listed on the preceding page.
Okay, thank you.
Motion and Senator Washington?
Yeah, thank you, Madam Chair. I do have a question. You mentioned that we struck the bill, but before that you spoke about penalties if they don't adhere to something. Can you just describe what those penalties are again?
Sure. On hand marked page 5 in subsection H, you can see the civil penalties. So the bill specifies that if an unlicensed individual performs X-ray duties without meeting the requirements of subsection E, which is the preceding page, the board may impose a civil penalty of up to $5,000 for each violation on the physician's office where the violation occurred, and $1,000 for each violation on the individual who committed the violation. And so in testimony before the House, the Board of Physicians specifically requested the amendments that were present at that time included the $5,000 violation, but the board additionally requested the $1,000 violation, which was then added. Yes, the Board of Physicians has reviewed the entire bill that is reflected in the amendments in front of you and is comfortable with the bill.
Let me ask, the reason I'm asking this is because yesterday we had a bill about pharmacists or their staff being able to inject 3-year-olds with vaccines. And we asked about penalties, but we didn't name the penalty in the law itself. So I'm wondering, why are we naming it here? And why not give the board authority like we did the bill yesterday?
I ask, have we talked to the House at all? Do we know if these amendments match the House? They match
Yes.
the House amendments?
The same amendments will be offered in the House.
Okay.
I
I would, considering the late time of year, I would like for us to,
No, I'm not opposed to what's in here.
Okay.
I just think if we're saying that pharmacist assistants or whomever are injecting 3-year-olds with vaccines, and we're not providing them with penalties if they do not go through the training that we prescribed in the bill, we should make it consistent, especially when we're talking about kids. And so I'm concerned that, I just wanted it to be consistent when we're thinking about kids and when we're thinking about the people and not just X-rays. So that's my only point. Thank you, Madam Chair.
I understand your point, but I like this bill. Thank you for your question, Senator Washington. We have a motion and a second. All in favor? Unanimous vote. Thank you.
The next bill. Thank you. The next bill is Senate Bill 846, which requires the Department of Labor to conduct a study on the actively seeking work requirements of the unemployment insurance system in the state and other states to evaluate the effects of ghosting on those requirements. So under the bill, to ghost means the failure of a claimant for UI benefits who is scheduled for a job interview with an employer to attend the interview or failure to maintain contact with the employer after the interview is scheduled. There are no amendments. There's no fiscal impact.
Who has a second? I have a motion. So Senator Glassmeyer motion, Senator Mount seconded, and Senator Ellis has a question.
Thank you, Madam Chair. It's just a concern. So people going through unemployment don't have money. A lot of times they don't have a fixed address. A lot of times they don't have cell phones. A lot of times they don't have access to receive mails. They're going through those changes. And so, I mean, I could have brought this up at the hearing, but in the interest of time, it was a long day. And so I was thinking a lot of times it might not be just intentional ghosting, but that they do not have access to these resources. And a quick story, I was president of the Meyerhoff Parents Association at UMBC, and just during the Great Recession, and we couldn't reach like 40% of the parents with the old address. The migration was so great, you know, and we had to reach out to students like, where are your parents now? And so I've seen that firsthand. It's not they're trying to ghost, but they're unemployed. They don't have money. They lose homes. They lose apartments, houses, cars to get to. It's just a terrible time for those people.
So
And-
Senator, they would have recently applied for unemployment, so they should have current contact information because this is an open claim.
Right.
This is just a study. So this
it's a stu-
doesn't make any
Okay,
decisions.
okay,
It's just a
okay, good.
study.
Yeah.
But I mean, I can remember people would come to me when I had my business and they'd say, can I use you? Like I came and applied for a job and I'd be like, no, I don't have any openings. But I mean, that's kind of a game they play.
Yeah,
So
okay.
I think the study's important.
Okay, well, it's just a study with that. That's
Okay,
good then.
so I have a motion and a second. All in favor of the study for ghosting? Unanimous. No, Senator Kramer, are you with us? 11 to
Next bill is Senate Bill 156. This is the bill that codifies in statute the name of the Port of Baltimore as the Helen Delich Bentley Port of Baltimore. And there is an amendment that would add Senator Gazzoni as a co-sponsor.
Yes. Oh, you have another amendment? Come on. Okay. How many people would like to be a co-sponsor on the Port of Baltimore renaming?
Everybody.
No, is that it? Nobody else? Okay, Senator Mounts, Senator Reedy, Senator Glassmeyer, Senator Bidle, Senator Hershey, Senator Guile. All right, so do we have do we do a motion? I've already forgotten. No, I thought you were making the motion. Senator Hershey's motioning, Senator Reedy second. All in favor of renaming of the Port of Baltimore? I'm gonna assume Senator Washington, you okay? Okay, I'm gonna assume Senator Guile voting for this, so 11-0. That's right, because she has to be on it. Okay. All right, so we're changing. No, we're not.
Senate Bill
Patrick.
595. This establishes requirements on carriers, plan administrators, and PBMs when calculating cost sharing contributions by insureds, deductibles, out of pocket limits. We've got a reprint here that Senator Hershey is offering some amendments just to walk through the bill. The first piece is that the amendment, what it does is it says that for prescription drugs and biologics, the requirements of the bill only apply to those that do not have an AB rated generic equivalent or an interchangeable biological product preferred under the formulary of the health benefit plan, or that have an AB generic equivalent or an interchangeable biologic product preferred under the formulary of the plan, and to which the enrollee has obtained access to the drug that they're on through a prior authorization step therapy protocol or exception or appeal process. So in other words, that the bill applies when there's a generic equivalent, or else if there isn't, the person has received approval to be on that drug through a process. The next And then the same changes are made to the provisions of law that pertain to requirements on PBMs when carrying out these functions.
Is that it?
Those are the amendments.
I'm happy to support my committee member. I just know these amendments are different than the House. So we're gonna go into conference committee, but that's fine.
You're right.
Okay, all right. So do I have a motion? Senator Reedy moved favorable. Who has a second? Second, Senator Reedy and Senator Hershey. All in favor of the amended bill, Senate Bill 595. Senator Mounts? Okay. It's unanimous.
Senate Bill 742 is a local Anne Arundel County alcoholic beverages bill. We were just waiting for a letter approval from the delegation. We've got it. This bill increases the fees for certain Class C per diem alcoholic beverages licenses when issued for one-day events with more than 1,000 attendees. No amendments.
Yeah, I'd love that. I'd like a motion on Senate.
Favorable.
Okay, Senator Classmeyer moved favorable on 742. Who's second? Senator Giles second. All in favor of the Anne Arundel County local bill? Thank you. All in favor? Unanimous vote. Thank you.
Senate Bill 760. This is the bill that establishes protections relating to the retail sale of gift cards. So I've got a reprint here that reflects some amendments that the sponsor, Senator Kramer, is offering. The first thing is what it distinguishes between open loop gift cards and closed loop gift cards under the bill. There's a definition of an open loop gift card on page 2 of the reprint. Think of the ones that have like a Visa branding or a chip and can be used at a variety of locations, at multiple unaffiliated merchants for goods or services. And so for these cards, there's a different timeline for when certain requirements on their bill need to be implemented, and that'll be shown up later in the reprint. On the next page, it's not marked, but there's an amendment that would strike a requirement that merchants register with the Consumer Protection Division as an online seller of gift cards. On page 3 of 5, this provision says that a merchant may not knowingly sell a gift card unless a notice is displayed, and the bill includes the certain information that has to be included in the notice. They also can't knowingly sell a gift card unless it's packaged in a certain way. So that's listed in the bill on page 3. For an in-person sale, it has to be at or near the physical location where the gift card is displayed, or for an online sale on the web page where the gift card is offered for sale, or that is displayed before the sale is finalized. There's certain packaging requirements for this open loop gift card that's listed below. It has to be enclosed in a secure packaging that's sealed in a certain manner, and that's listed below. It has to include a warning that states the following or uses language substantially similar to the following. Do not sell or purchase if packaging has been broken or indicates tampering. On page 4, we have certain gift cards that do not need to be packaged in this way. If it's chip enabled or sold exclusively by a merchant for use only at the retail establishment of the merchant, or a group of unaffiliated merchants for use at the retail establishments of the unaffiliated merchants. And if it's secured in a physical location within the merchant's retail establishment that's accessible only by an employee of the merchant. This provision 144603 says that merchants must train employees on how to identify and respond to gift card fraud. The Consumer Protection Division has to create a model notice and guidelines regarding the detection and prevention of fraud. On page 5 of the reprint, this establishes record-keeping requirements for third-party gift card resellers. And so all of this documentation that they have to collect when making this type of sale is listed below. They have to keep it for at least 3 years. Below in this subsection C at the bottom states how the information is to be recorded and maintained. On the next page, we have prohibitions on third-party gift card resellers engaging in certain activities, like failing to make an entry of or falsifying, destroying, or removing any information that's required to be recorded and maintained under the bill. There's a provision in here that that states that a law enforcement agency may request that the issuer of the gift cards or the issuer's agents preserve and provide to the law enforcement agency all relevant evidence reasonably foreseeable as of assistance to future criminal actions in accordance with state law. When there's a filing of an official report with a law enforcement agency by a person alleging to be a victim of theft of one or more open loop gift cards with the value that exceeds $500. And then below we have an amendment here. We state this is a violation of the Consumer Protection Act and subject to its enforcement and penalty provisions. An amendment here would make clear that the right of action under the Consumer Protection Act does not apply to a violation under the bill. A person has to be given who violates the bill has to be given a warning for a first violation. And then below you have provisions that apply to closed loop gift cards, and these are the ones that are issued to a consumer on a prepaid basis in a specified amount and redeemable or on presentation by a consumer at a single merchant or a group of affiliated merchants, so like a Target or like a Home Depot. And so there's more time to implement the bill's requirements for these gift cards, I think an additional 4 months. And I think there are some distinct, if you go to the next page, there are some distinct packaging requirements for these closed loop gift cards that's listed in the amendment. So I think that hits on the highlights of the bill. Yep.
Anything in this bill as amended deal with how long someone has to redeem the gift card?
No.
Okay, good. Just making sure. I didn't think so, but I thought I would ask.
Okay. Senator Mouse, you have a question?
Is there anything in the bill, is there anything remaining in the bill that deals with the private right of action?
That's out of the bill.
Out of the bill. Okay. All right. Any other questions? Can we have a motion favorable?
Favorable.
Senator Klassmeyer and Senator Hayes, all in favor of the Consumer Protection Gift Card Scam Bill. Thank you. We have to thank Patrick. He virtually rewrote that bill. He's had a really busy week.
We'll give credit to the amendment office. There's some bill drafting. They did all those amendments.
All right. Thank you, Patrick.
Senate Bill 778 is a bill that requires health insurance carriers to provide coverage for all medically appropriate and necessary hearing aids for an adult covered under a policy or contract. Under the bill, carriers may limit the benefit to $1,400 per hearing aid for each hearing impaired ear every 36 months. And an insured enrollee may choose a hearing aid that is priced higher than the benefit limit and pay the difference in cost without financial or contractual penalty to the hearing aid provider. There's one amendment that specifies that the coverage will be provided if the hearing aids are prescribed, fitted, and dispensed by a licensed audiologist.
Is Costco a licensed audiologist?
If they have one working there. Yeah. So.
Do I have a motion on Senate Bill 778? Okay, so we have Senator Klassmeyer and Senator Reedy, all in favor of Senate Bill 778. Senator Washington, we okay? Senator Ellis, we okay? Senator Kramer. All right, thank you all. 11-0.
Okay.
To wrap this evening up on, the next bill is Senate Bill 332. This is a bill that would require hospitals and urgent care centers in the state to implement an evidence-based protocol for the early recognition and treatment of patients with sepsis and sepsis-related conditions. you have a reprint in front of you. This bill is already over here in the Senate from the House with these same amendments, and there was agreement between the hospitals and the urgent care centers on the bill. So if you look at the reprint, you'll see that again, they still have to have a protocol in place, but that's about all they have to do. The hospital's protocol has to comply with the centers of CDS, and there's a separate requirement for psych hospitals. The next, on page 2 of the reprint, you see most of the bill is struck, and then we go back down to language that was left, that if a hospital is submitting data to CMS, then they're presumed to have met the requirements of the bill. And each hospital and urgent care center will have training, periodic training on the identification of sepsis in their protocol.
On Senate bill.
Move favorable.
So Senator Reedy and Senator Glassmeyer, right? Okay, Senator Reedy and Senator Glassmeyer, can we have a vote on Senate Bill 332? So unanimous vote, 11-0. Thank you.
Okay, the next bill was heard a couple weeks ago. This is Senate Bill 469. It authorizes a protest against a cannabis license renewal if they filed with the administration, if at least 10 individuals or residents, commercial tenants who are not holders of or applicants for a license, or real estate owners, and are located within 1,000 feet of a licensed premises. There are no amendments to the bill. This is based on similar language that applies for protests against renewal of liquor licenses. And if you go to page 2, you'll see all the basis for this protest are listed, and they have to be filed at least 30 days before the license expires, and the administration may not approve the renewal without a hearing. And then there's other criteria here based on if they find no evidence, they can approve the accrual, and then there's some requirements here for the hearing.
Motion for Senator Glassmeyer and Senator Washington. Thank you. And all in favor of Senate Bill 469? I'm sorry. Okay. Senator
So
Hayes.
during the testimony, a lot of it was the fact that they were located in like a residential area or a mixed residential commercial area. Would it be considered spot zoning or whatever if we were to say it just residential and or mixed residential commercial?
I don't think it involves itself with you just have to be within 1,000 feet, and it has to be at least 10 of you. So it doesn't talk about any zoning or anything like that. It's just if you're one of these folks who are eligible to complain, and it could be anywhere. You could be if it's spots.
But if you're on a commercial strip, they're more armed to protest if they don't like you. Right? Whereas it sounded like the testimony was mostly residential. It's fine. It's good. We'll fix it on a House bill.
Okay.
Senator Washington.
I just wanted to clarify what the senator said. Did you say within 1,000? You can only protest if you're within 1,000 feet of that facility?
Yes, located within
Understanding.
1,000 feet of a licensed premises. Yes.
That's actually pretty broad, because some bills are 250 feet for standing, so 1,000 feet's pretty broad.
Right. I mean,
That's true too.
I mean, within a mile radius of it sounds better, but
Yeah.
this 1,000 feet sounds small.
I'm sorry, Senator Hershey, what?
I wouldn't have minded if it was stronger, but I'm okay.
We can always come back and make it stronger.
I'm just saying. I'm all right.
So I think we had a motion and a second. Did you get those, Tammy? Okay. All in favor of Senate Bill 469? Unanimous, 11-0. Thank you.
Okay. The next bill on your list is Senate Bill 478. This was on the voting list the other day and got held by Senator Ellis. You have a reprint in front of you, and Senator Ellis has offered amendments to conform it to the House bill, which is on its way or already over here. But these aren't exactly the same amendments as the House bill. There was some, it's all technical. The idea was to say that uniform services would be eligible for the private sector if they authorized a preference. But there were some tweaks here because with the private sector stuff, uniform services were already included. So I made some changes here to conform it to what, to so it's more legally correct. And then regarding the preference for for state employment, the House amendments are the same, except you strike military spouse because you've gone to the uniformed services, and spouses, you're assuming that, then the public health service will be military, and that's not correct. So we'll work it out with the House on.
Senator Hayes, move favorable, Senator Osborne, move second. I would like to add my name to the list. Senator Ellis and Senator Glassmeyer would like an amendment adding them. Anybody else?
All right, we have a motion and a second on an amended bill, Senate Bill 478. All in favor? All right, unanimous vote. Thank you.
Gotta write this big here because I always forget to add sponsors. Okay, the next bill on your list was also held from the other day. This is the bill that creates the prison education. It's Senate Bill 623, and it creates the Prison Education Delivery Reform Commission. And the bill is held because Senator Washington wanted the Maryland Correctional Enterprises added. So if you go to page 2 of the reprint, you'll see that a representative of MCE will have to be appointed by the governor. And then Senator Hayes wanted an additional item for them to look at. So if you go to page 3 of the reprint, you'll see that they also have to evaluate current workforce programs in which inmates participate in the program's effectiveness and training for employment opportunities that result in living wages.
I'm good with the bill. I just question, what's the gout? I noticed the other thing in the amendment is the Goucher College Prison Education Partnership. Is that something pretty unique that there's not like 5 universities in Maryland with some similar? I'm just asking.
It was from, this was from MICUA, and they have this unique program there, and they wanted to be added to say they consult with them also.
No problem. I was just curious. Thank you.
623. Unanimous vote. Okay.
Okay, the next bill on your list is Senate Bill 825. This is Senator Kramer's bill that would authorize nursing homes or authorize the department upon the request of a local government to allow that local government to inspect nursing homes. You have a reprint. This is Senator Kramer's bill. The bill is introduced, did a lot more than I think the sponsor intended. So if you see at the reprint, most of the bill is struck. Most of the language, most of the bill is struck, and you go to the section of the code, which is on page 5, which deals strictly with nursing home surveys and inspections. And at the bottom, you'll see what's left, that on the request of a county, the secretary shall delegate to the county, because the department had a concern about any local government, and county is understood under general provisions, the authority to conduct these site visits. And there's also language added by the sponsor that, I'm losing my voice. Unionizing all nursing homes. That requires. If this is granted, then the county, then the state and the county would share the cost of the inspections and conducting the surveys.
Senator Washington has a question.
Yeah, thank you, Madam Chair. So in Prince George County, we have 27 municipalities. And a lot of those 27 municipalities have the ability. Yeah, I understand that, but my point is saying that they have the ability to do inspections of different multifamily housing. If they wanted to, they'd be able to, they also have the ability to provide any rent control or whatever they want over these multifamily units. And they conduct their own inspections of these multifamily facilities too. So if you say counties, if you only say counties, then it leaves them out from conducting those inspections as well.
No, I don't think your municipalities inspect nursing facilities.
Special training required for surveyors of nursing home facilities. They would need to be trained and then apply to be able to do that.
So, but right now, only the counties. So does all the counties have this ability right now, and do they all have the training right now?
They don't all want to do it. Montgomery County apparently has the people and they want to do it.
It's not mandatory.
Yeah, so the issue has been that the department is way behind
I
on,
understand your point.
doing-
I understand your point, Senator, of why you want the bill and why it's important.
yeah.
I
And the request came in, please, that if it was municipalities, it just didn't make sense. And they said, please limit it to the county health departments.
Got it.
If the county health department wants to do it. I suspect no municipalities
As a
that
health
want to.
That makes
but-
more sense. Thank you, Senator, for that.
Yeah.
Out of order, I need a motion and a second on Senate Bill 825. Senator Classmeyer and Senator Reedy. I love it.
And before you, Senator Klossmeyer was going to offer an amendment, but I don't believe your amendment is necessary because of the way the bill's been amended.
All in favor of Senate Bill 825? I will say, we heard today that we're not getting these inspections done. Okay, we have a unanimous vote. I heard it in my bill.
Oh.
Yeah,
Okay,
go ahead.
the last bill. This is a thick bill and the sponsor worked hard with the triumvirate to work this out. And I believe they're and I believe it's a good.
It's a good bill. It's a good bill.
There is agreement on the amended bill you have in front of you. And first off, I'll start by saying last session, you extended the COVID-related authorization to direct delivery to Maryland consumers from Maryland manufacturers of wine, beer, and spirits. But you also limited last year what could be delivered relating to beer and spirits because wine was already limited. This bill makes permanent that ability to direct ship wine, spirits, and beer from a manufacturer in Maryland to somebody in Maryland only. And they can't use a third party to do this. It has to be the people who work, it has to be somebody who works for the manufacturer. I'll go through the amendments. All direct shipping in and out of the state is out of the bill. This is only, I'll call it direct delivery. That's a better way to call it. If I say ship, I'm gonna get confused.
You say manufacturer, are you referring to like breweries?
A brewery, a winery, or a distillery.
And there's no limit or anything on what the size of that brewery might be.
The size of the brewery?
Right.
It's not addressed in this bill.
Gotcha. Right. But it gives them the ability and they have to do it themselves.
If they have a license, if they're currently licensed
Yep.
under the state, then they can direct delivery to consumers in Maryland.
Gotcha. Thanks.
Senator Guile motion.
Okay,
Who seconded? Senator Guile and Senator Classmeyer.
Compromise bill.
Yes, that we all love.
Not happy with.
Yeah.
Compromise.
I think.
May I have the vote
think they've
on
all
Senate
been
Bill 1041? Come on.
That's okay. I mean,
Yes.
There it is.
I think.
All right. Senator Washington,
I-
unanimous vote. Senator Lamb, were you voting? All right, thank you. 11-0.
Basically.
Yes,
the same
sir.
Requirement for all three. It's almost.
836 and
Same
Senate
type
Bill
of bill.
1104.
We can. I'll second your I can't. Senator Classmeyer, please second
Has
the
to be
unfavorable.
produced in Maryland. You have to have.
So
their
may I
house.
have, we're gonna vote unfavorable on the two withdrawn bills. Favorable and the unfavorable, unanimous, right, Senator Hershey? Unanimous, 11-0. Thank you. You all worked hard today. I'm sorry we're so late, but thank you all for being here. And Senator Reedy, I hope you have a good time tonight.